There are over 450 million people worldwide who are affected by type 2 diabetes. Over 1/3 of these people will develop something called diabetic neuropathy. I'm Dr. Douglas Davis, neurologist, Salina Regional Health Center, Department of Neurosciences.
Well, doctor, thank you so much for coming on the show. We're going to be discussing diabetic neuropathy. First of all, let's talk about diabetes and diabetic neuropathy.
Right, so there are around 450 million people worldwide who are affected by type 2 diabetes. About 1/3 of these will develop diabetic neuropathy. Neuropathy is a diseased state of the nerve. That's what neuropathy means. And people with diabetes have a lot of different symptoms, but one of the ones that is common is issues with the peripheral nerve, especially in the feet and the hands.
From what I understand, it's quite painful, or can be, right?
It can be painful. Not all diabetic neuropathy is painful. Some of it can just lead to a numbness sensation, but sometimes it can be very painful and debilitating for patients.
So let's talk about treatments for it and what you're doing as a neurologist.
So there have been several different treatments for the painful type of neuropathy. We don't have a lot for just the numbness that some people get. For the painful type, medications in the past have included gabapentin, pregabalin, duloxetine, over-the-counter creams and rubs, sometimes amitriptyline. The over-the-counter creams contain different ingredients. Two of the most common ones are lidocaine and capsaicin.
Let's talk about some new treatments that you're hearing and that you're starting to look at.
Sure. One of the new treatments that we have is patches called Qutenza. I mentioned capsaicin earlier that we've had for a long time in over-the-counter topical concentrations of usually 0.8%. Capsaicin is the active ingredient in hot chili peppers that gives it the heat. So the patches actually contain 8% capsaicin, so 100% more concentration of the capsaicin than the over-the-counter creams. What we do is we take the area of the foot that has the symptoms and we cover those with 2 plastic patches, and then we wrap the feet and keep it on for about 30 minutes. Capsaicin has a very high affinity to some of the pain receptors, and so when we explain it to patients, we kind of liken it to when you get into a hot shower. So when you first get into the hot shower, the water feels very, very hot, but as you sit in there for longer, you desensitize to that heat.
Besides what you're doing, are there other options, maybe not necessarily by you, but that you then refer on to?
Right. Once we see that the medications and the new patches aren't working, we can refer out to neurosurgery. There's a new procedure that they're doing that has very good results called a spinal cord stimulator.
All right, thank you so much for some great information. And thank you for watching. For more information, please go to the Neurosciences page of srhc.com and like Salina Regional Health Center on Facebook and follow us on Twitter and Instagram.